Hello, good evening, everyone. So, my name is Vaishali Sonale. I am an occupational therapist and I'm working in this field past 13 years. I've completed my master's and bachelor's of occupational therapy from India, and I am sensory integration certified as well. So, I would like to thank Autism Connect for giving me this platform to share my knowledge in this field. So, today's topic is about toilet training intervention in children with autism spectrum disorder. So let's get started. All right. So why autistic children face difficulty for toilet training? First, because of the communication issues. Most of them have speech delay, or that's why they face difficulty in expressing their need to use the toilet, expressing their need their bladder is full and they want to void it. So all these difficulties, along with the sensory issues, the lack of awareness of their own body, lack of awareness of where is the toilet located, where they can go and avoid their urine in there. The difficulty in motor planning to remove their clothes before going to the toilet. If along with that, different sensory issues such as they might be fearful of the sound of the flash or the different lights in the bathroom, bright light, different texture they might feel while walking inside the toilet. They don't have a fixed routine for going to the toilet. They might have motor planning issues. They might have a difficulty in imitation. For example, if they want to, if we prompt, do you want toilet? Or we show a picture of toilet and we ask them to point at, they have difficulty in that imitation skills. So all these things will affect their toilet training. So when should we know whether the child is ready for toilet training or not? Usually at the age of 2, chronological as well as the mental age, the child is ready for the toilet training. Second is awareness, whether the child is aware of whether he is wet or he wants to go to toilet or he knows his toilet routine. So when he go to the toilet, what he's supposed to do, if he's aware of that, or he wants to go to toilet, or he knows someone is in the toilet and he have to wait for some time and he need to hold the urine, or he need to hold his bladder for that time, whether he has a regular bowel movements or not, if there is any medical issues related to the bowel incontinence or which affects the toilet training. All these factors are we have to consider before the starting the toilet training. Now, toilet training starts with the intensive program for 2 to 3 days, which parents have to follow at home. So we are going to discuss in that no more diapers, what is the toilet schedule, how to increase the fluid intake, reduce the how to reward after completing the toileting, dry pan checks, positive practice for accident. If the accidents occurs, then how to take it positively, and how to collaborate with other caretakers or teachers or other therapists in different settings. So what are things are required before toilet training has to start? So first of all, parents have to prepare themselves and they have to choose appropriate time or a day to start, because it's going to be very intensive for 2 to 3 days. So parents cannot like do it for the one day and just leave it. No, they have to do it for 2 to 3 days and then carry forward the same thing in different settings, such as schools or therapy centers or daycare centers, wherever the child is going. Then take the data of the toilet schedule from starting until the end. Collect all the materials required, develop plan, who is going to stay with the child, because that adult have to be focused and he have to constantly observe the child 24 hours for this toilet training program. Then prepare a checklist. In that checklist, what things the parents have to take care of. They have to read all the procedure carefully, rule out the medical causes which will affect the toilet training. So maybe they can go to the medical practitioner, doctors, and consult themselves about the toilet training. Determine who will coordinate the program in different settings. For example, in the school, who will be take care of collecting data or taking the child frequently to the toilet. Contact the caretakers across all the settings. Prepare materials such as data sheets, extra fluids, salty snacks, extra pans. Check the mobility and dressing skills of the child in advance. What materials are required? Extra underpants, definitely. Pull-up pants, which can be used only in the night time. Accessible toilet. Please check the height of the toilet is appropriate for the child or not. If it is not, then they can arrange extra a height, a stool or a table where child can step and sit on the potty. Highly preferred rewards, preferred liquids and salty snacks. Data sheets. Please don't skip the data sheets because this is very important. We'll discuss it in further. Extra clothing, pant alarms. I don't recommend pant alarms, but in few cases, it does help the child. And visual cues. Now, prepare the environment before you start. So, prepare a comfortable seat for the child so that he will not feel overwhelmed or anxious when he or she goes to the toilet. So there are different types of sitting chairs. Potty seats are available in the market. They can arrange it. So what to wear? This is a big question. First of all, they have to completely remove the diaper and just wear the underwear for the child. Child needs to feel sensation of being soiled. That's why they have to wear underwear, not a diaper. If they wear diaper, then the diaper will soak all the urine and everything, and they will not feel whether it's wet or dry. Plastic pants parents can wear above the underwear, because if they feel it will be messy around the home, just to prevent that, they can wear the plastic pants. Pull-up pants they can wear only in the nights. Just wear them before the child goes to the bed and remove it in the morning when the child's wake up and take him or her directly to the toilet. Arrange extra pants, but it should not have zipper, buttons, or belts. So it doesn't take much time and it's easy for the child to learn. Now let's discuss the procedure. First of all, they have to completely wean off the diaper for 2 to 3 days. Only in the night time they can wear just before going to the bed. Every 50 to 20 minutes, parents have to take the child to the toilet. Before going to the toilet, they have to show the picture of the toilet to the child, and they have to tell the child it's time to go to potty. And they take the child immediately to the toilet, remove the pants, put the child on the toilet seat, and request them, okay, it's time to do potty. Now, they have to take this frequently, so they develop the routine and they understand the concept of why they are going to the toilet. After between 2 visits of the toileting, they have to do the dry pan checks. Then after that, if the child has passed the urine successfully, reward him with the tangential things such as candies or favorite toys or M&M or anything, which the child is like, he is highly motivated for that. If there are accidents, then be positive and calm and then respond to that accident. Record the data on the data sheets. Now, how to schedule the training? To provide a frequent opportunity to practice. So that's why we have to take the child every 15 to 20 minutes and increase the duration based on data collected in first several hours. If you see the child is able to hold the bladder for 30 minutes, then maybe after few hours, you can take the child for every 30 minutes. Increase the fluid intake. So the bladder is full and the child will void in the toilet. Now, just before going to the toilet, prompt the child, do you have to go to potty? Take them directly to the potty. If the child asks by himself or herself, take them immediately. And if he voids, then reward it with with anything which the child likes. Rewards. Reinforcement is very important because we all doing things for the reinforcement only. If the child is successfully avoiding in the toilet, please reward him with his favorites, maybe food or a toy or activity, which should be given immediately inside the toilet. Dry pants check. This occurs between two consecutive toilet trips. Avoids which helps in avoiding accidents and teach continence to the children. What the parents can ask the child, take the child and touch the pants and say, "See, you are dry. Good job. You did good job," and praise him. Positive practice for the accident. They're going to be accident because the child is just learning the concept of using toilet. He was on the diapers for so long, and suddenly if you remove the diaper, that definitely they're going to be accidents. Maybe on the first day there will be several accidents. So the parents have to be calm and they have to use a neutral voice, that do not shout or yell at them. Be calm and just say, "No, you wet your pants. It's time to go to the toilet." Take them to the toilet, do all the steps, change their nappies, take them again back to the accident area where he did pee or poo, and show him the visual and do all the steps for at least 2 to 3 times. So they understand the concept of going to the toilet and not peeing or pooping outside the toilet. Then when the child had accident in between, for example, the child is supposed to go to toilet at 10:30, but he had an accident at 10:15. So start counting from 10:15 onwards for 30 minutes. And after 30 minutes, that is around 10:45, take him again for to the toilet. Data recording is very important, so we will understand how long the child can hold the bladder, and it is very important. You can add a date, time, and place is also important sometimes, because the child we had one student, he was on the toilet training, and whenever we used to take him to the playground, he used to do pee pee in the grass area. So that concept was developed at home because the parents were allowing him to pee outside in the garden. So that's why to mark the place is very important sometimes. Then yeah, so on the data sheets, you can add date, time, and place. You can modify your data sheet according to the child, because each child is different. And it helps in voiding in different places, and the child is able to void in the toilet. Schedule, okay, sorry. Okay. Yeah. It helps to regulate the schedule of toilet training, and the parents and everyone, caretakers, are aware of how long the child is able to hold the bladder. So these are some examples of toilet training, and there are some markers. For example, if at 6 o'clock he was dry, or he urinated, or there was a bowel movement, he pooped. So you can just mention that in that box, like at 6 o'clock he urinated, or at 8:30 there was an accident, he peed outside. At 10 o'clock, he again peed in the toilet, something like that you can mention. So that's why you can modify it according to your understanding. This is another sample. Yeah. So after 2 to 3 days, the same steps have to carry forward in different settings. Only thing, you have to reduce the fluid intake. You have to go back to the normal fluid intake for the child. But after 3 days, when he goes to the school or daycare center or nursery, you have to coordinate with the teachers, other caretakers, and therapists. So they are aware, like, okay, he's going through a toilet training, and every 20 minutes he have to go to toilet. So he doesn't miss the opportunity to use the toilet appropriately. So this is what coordination is important. So all the caretakers should be aware of. The parents need to inform what they are doing, how they are doing, what are the key points they have to take care of, who will take the responsibility for data collection, and who will take him to the toilet in the schools and different settings. That has to be clear before the toilet training starts. Teaching communication. Communication is very important. If the child is non-verbal, then use of objects or pictures or printed words is very important, because we need to teach them how to communicate at the same time during toilet training, because this is going to help the child to understand their own body as well as what exactly he has to do. So this picture, if the parents wants to use a picture, this should be available everywhere in the home. In all the rooms, they can put the pictures all over. Maybe in the kitchen, they can put it on the fridge, on the door, in the hall, living room area, they can put it. Whichever place is easily accessible for the child, they need to put those pictures of the toilet in the house during the toilet training. In the school as well, all the teachers and therapists need to carry the visuals, or on the pad. um, the parents can put one picture, so it's easily accessible for the child. In public, when they go out, they can carry a small pictures and put it near the bag, or on the bag, or purse, so he can remove and show it if he wants to use the toilet. He should be able to easily access those visuals. Okay, yeah. Teaching initiation. This is what very important. That's why every time the parents or a caretaker takes him to the toilet, we have to prompt verbally as well as visually by showing a picture of the toilet and telling him it's time to go to potty, and take them to the toilet. So this will help him to understand how to initiate. Yes. Now, what are the important tips we need to consider? First is be neutral and calm when there is an accident. Positive practice is very important, because if the parents become strict or yell or shout, they might feel anxious and fearful to go next time to the toilet, and it will affect the toilet training. Avoid sitting or spending too much time in the toilet. When you take the child to the toilet, avoid spending too much time, not more than 5 to 7 minutes, not more than that. Do not spend too much time in the toilet. Make it a little bit fun way, so child feel comfortable and confident in what he is learning. Common problem. Some kids don't they are unable to locate the toilet, they because of the poor motor planning as well. Other than that, because of the sensory issue, they feel fearful or anxious inside the toilet. And sometimes the boys face difficulty teaching standing versus sitting, because sometimes the boys in the public washrooms, there are no sitting toilet available sometimes, so they might get confused like what is happening. So yeah, parents have to consider this also. These are the common problems they face. So some of the kids, they don't achieve the bowel training because maybe they having a constipation, or maybe there are behavior issues, or the data is not collected properly, and that's why parents doesn't get particular doesn't understand what is happening, what is wrong with what the things are going wrong with the child in toilet training. So yeah, so these are the things which needs to be considered. In the night time, reduce the fluid in the night time. They can wear pull-up pants just before going to the bed. And some of the conditioning approaches where pant alarm or bell can be used, but I don't recommend that because I feel it's not comfortable for the child, as well as it might develop different kinds of behavior in the child. So make sure are you 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 attend a proper therapeutic evaluation for that, using that pant bells or alarms, because it might develop some negative behaviors as well. Reinforcement is very, very important in the nighttime routine as well. So yes, and thank you very much. Is there any questions? All right, there is one question. Let me see. A person, I did this home visit before ASD girl child. After this problem arose with the girl in the toilets, parents not informed to give the special educator, give to the special educator and shadow teacher. Okay, so I feel the child doesn't know exactly the routine, what she is supposed to do in the toilet, I feel, and this needs to be evaluated completely. First of all, parents needs to involve in this. The toilet training has to start at home first, and then it has to carry forward in the school and different settings. Yeah, this might be a behavior, or it might be a sensory related behavior, I would say. So this needs to be, we need to see what exactly is happening, how this has started and what was the reason behind. So this needs to be checked thoroughly. Yeah, at the beginning, the parents needs to clean the child, because that's quite difficult. First of all, we have to prepare the child to use the toilet. Once the child is ready for that, then only you have to add slowly, step by steps. Cleaning is, it's very difficult because it's also sensory, and motor planning is also there. So first they have to use one hand to use the shower and other hand to clean themselves. So we have to teach them slowly. Maybe the teacher or a parent can hold the shower water thing, and as from the child with other hand, hold his hand and ask him to clean slowly, slowly. Maybe before using this strategy on the child itself, maybe they can do a pretend play on the doll or something. So the child knows, oh, this is the way they have to do it in the toilet. So that's what I recommend. Yeah. Any other question? Okay. Thank you so much, Autism Connect, for giving the opportunity. And I will stop my live here. Thank you very much. Thank you, everyone, for joining this live. Thank you.